Good morning, everyone. It's a great pleasure to be here. And it's great that Edge Hill is choosing to, in a sense, celebrate, mark World Mental Health Day by helping us host this really interesting conference. Great too that we're here talking alongside Everton in the community. Fantastic that this football club, of all of the causes that it could have chosen to get behind, has majored a lot on mental health and mental health issues and people with mental health issues. And later on, when we talk a little bit about stigma associated with mental health, I think that was actually a really brave thing for Everton in the community to do. And I think we should all at every stage recognise how courageous that approach was. So for those of you who don't know much about Mersey Care, we're an NHS trust. We provide mental health services for the population of Liverpool, Sefton, Southport and Formby, parts of Knowsley. We also provide significant forensic mental health services to the whole of Cheshire and Merseyside. And we're only one of 3 organisations in the country that works with that most vulnerable group of people with mental health problems who require the sort of facilities of a high secure hospital. So Mersey Care also runs Ashworth Hospital, which isn't very far from here. So the subject today, sport and physical activity and mental health promotion. I'm not going to start from the point of view that we need to prove that this is an important link. I think there's loads of evidence. I'll show a little bit, but I think you're going to hear today the huge efficacy there is associated with mental well-being and physical and sporting activity. And we know it from inside our own trust. At every layer of our organisation, we think about how to make physical activity a real option for people. I suppose the real interesting question for me is, well then, if you think it's so good and we know so much about it, why aren't we putting a lot more money into it? So the funding question, I don't mean we necessarily as a trust, but I mean, you know, those who fund the NHS in general terms. And I thought it would be useful today just to take you through why I think it's difficult sometimes to create real change in services, but why it's really important that through the sport and physical activity movement in relation to mental health, that I think we're reaching a point where, you know, we could soon see a tipping point. So, how do I move this? Any clues? Just seems stuck. Oh, here we go. So, first thing is a little bit of background, and John did speak a little bit about some of the facts and figures, but it's worth just remembering the scale of the issue in terms of the impact we hope to make. Somebody able to move it on, just? Yeah? Oh, there we go. So, mental health problems are common. So, 1 in 4 people will experience a problem during the course of their lives. 1 in 10 children, a massive number, experience mental health problems. Depression affects somewhere around 1 in 12 of the whole population. Self-harm rates in the UK are the highest in Europe. There we go. So some shocking figures that I want to build on here, really, in a sense. First one, 23% of people in Britain receive some treatment or service, but only 23% of people, against really a massive problem in many respects. Only about a quarter of people in Britain with a mental health problem receive some sort of ongoing treatment. So it's an obvious question, what about the other 3/4? And in a 12-month period, only 3% of people with mental health problem saw what we would describe as top-end professionals. Some people would argue that's a good thing, but I don't know. Interesting question. Then moving on, I hope. There we go. Lots more issues here. I'm not going to read them all out to you, but if you just take a second to absorb them, what it tells you is there are a lot of people out in our communities who are having a real tough time with their emotional well-being, and somehow we're not always getting to them in terms of, for example, the services that I run, or GP-led services, or whatever. And I think this is one of the massive opportunities for sport and physical health and other forms of involvement, which is really gets us into that self-management space. You know, so some of these figures already say there must be other things we can do up front to make the story better. The impact of all of this is stigma, I think, is one of the most massive bits of impact you can find. Just put your hand up here if in the last, let's say, 3 months you've had a cold, flu, sniffle, feeling generally sort of physically under the weather. Stick your hand up. Right, so probably a third, maybe a quarter of the audience. Stick your hand up if you've felt depressed, anxious, panic attacks. Yeah, so the number's a lot less. Thank you for those who've put your hand up, but the number should be about the same. You've just witnessed stigma in action, okay? There's something about, you know, having the sniffles and the flu that you're happy to admit to, having panic attacks, depression, anxiety, lack of self-esteem. You're much less keen to talk about it, and that's stigma in action. People with mental health problems are least likely in society to find work, to be in steady long-term relationships, live in decent housing, to feel socially included, part of a community, part of a network, part of mainstream society. So these are huge, significant problems, not just for the health service, but for social cohesion. You know, this is what these are issues that erode and eat into society and our public places. So I think the next slide says, there's good news, in case you think I'm a harbinger of doom. Oh, sorry, okay. Doesn't quite say this good news. Could you just keep moving when I'll wave you and, you know, yeah. There's a floorboard there or something that must, you know, there must be a wire. And here's a really huge one. The economic cost of mental illness to the English economy is £13 billion a year. That is just a colossal undertow. So we can talk as much as we want about economic recovery. I frankly doubt if you can have real economic recovery and continue to have an undertow that feels it's as big as £13 billion a year. So that's approximately 1/10 of the whole NHS bill per annum. So you can see the opportunity to do things really differently if we chose to tackle this problem. But there are reasons to be optimistic. I'll not read these again, but there's an online survey at the top that shows a key point, 2% of people were offered exercise therapy. Only 2%. Yeah, you go down to the bottom, 60% would be prepared to try alternative therapies. So there's a lot of will for people with mental health problems to go do different things, try different things. But actually, there's something in our system that's constraining us to allow these alternatives to come into place. Sometimes it's because there isn't a huge amount of evidence, sometimes. But I think if you look at the physical activity piece, I think the evidence is sort of pretty overwhelming. And I've just put a little bit of data up here. You may have seen it before. But it looks at case-level depression in comparison to physical exercise with none, low, medium, or high exercise. And you see a very clear reduction in the adjusted odds ratio around case-level depression against the impact of even moderate exercise, I guess. And I suspect you're going to hear loads and loads and loads of examples that bring that two-dimensional graph to life today. If we go to the next one. So in a sense, what is the problem Why is it 2% of people getting this approach? Why aren't we pushing a lot more into this? And that's a brilliant question. If you're not asking that question, I think it's probably the question you should be asking. Can I have the next slide, please? So I think probably one of the issues is that the urgent outweighs the important. And by that I mean we're really busy dealing with lots of people who actually are already quite seriously ill. And it feels like we're talking about something that's relevant to people who are probably not so mentally ill. But actually I know that with some of our illest people, physical exercise makes a massive difference to their lives. We know that in Mersey because we run a full range of services. We have some of the illest people in the country, and they benefit hugely from physical activity. And then we know that as you approach more mild to moderate conditions, that you can see a real massive impact on people's attitude. Next slide, please. And here's a sort of urgent outweighing. There's a lot of data on this, but I think it's a sort of look at one. Might be something you want to talk to Andy Burnham about this afternoon, I don't know. But staffing levels in mental health services are reducing. The number of doctors are reducing. Some people might say that's a great thing. And actually, if we do more of this self-care and management, we can sustain those drops. And actually, you're not getting an argument from me on that one, you know? But I don't think we're at that place yet. If you look up above, beds are dropping. Look at the reductions in beds. The number of patients are increasing, and the amount of money is going down. So that's what I mean when I say the urgent is driving out the important. These are really urgent issues. We have to deal with them, but as long as we have them, it means that it's difficult, I think, to get to what some people would describe as nice-to-have issues, like physical activity. I'm not describing it as a nice-to-have. I think it's actually pretty essential based on our own experience. So I just want to run through why it's really difficult to move the pieces on the chessboard, to make the things that we think, like physical activity, that are really practical, to make them a better funded, more organized approach in our services. Next slide, please. So I'm going to run through 4 slides that tell you a story of why people are really interested in this. So in July, GP commissioners are not spending enough on mental health labour claim. So that's in the British Medical Journal. And I think maybe Andy Burnham will talk more about this as it goes. I think that's probably true. Next slide, please. The Liberal Democrats say mental health research should be the next big breakthrough. I don't know if you were listening to Mr. Clegg yesterday, but for the first time he announced waiting times for mental health services yesterday. Leaving the politics aside, that's a great thing to have happened, because actually we don't have these same conversations in physical health services. Can you imagine a conversation about cancer patients where we said, well, actually, we don't think research is a priority for cancer patients? Can you imagine? Can you imagine the front page of the Daily Mail? Can you imagine the front page of the Daily Mail with this one? That's stigma in action. That's stigma in action. Mental health services, 23% of everything the NHS does, 5% of the research budget. That's stigma in action. Next one, please. The Telegraph. Tory modernisers are getting their heads around mental health. So clearly all 3 parties are completely getting to the place. And that was what, October 2014, so that's just really, really recent. So all 3 parties are getting to a place where this is an absolute priority. You get a sense that it must change. It absolutely must change. So the next slide clearly shows the Journal of the Royal Society of Medicine, integration or disintegration. Click again for me. Here's the interesting bit. 1979. It could have been a headline written last week. If you'd have taken all of those headlines from the newspapers, that one fits, doesn't it? It completely fits. Physical and mental health integration. It's almost 30 years since it was written. And I think there's the issue. When you wonder why we can't be pushing more of our resources the things that we think absolutely count. My personal view is I think it's because of the stigma associated with mental health services. I don't think it's something that has had the same political perspective on it, other than maybe in the last 2 years, when I think it's become a real issue for the political parties. If I'm being really cynical, I'm not sure it's because they think it's the right thing to do. I think it's because there's a £13 billion, undertow associated with it. But if you think about the headlines that many other conditions achieve and get, I think it's a clear evidence that there is serious stigma at play, even I think at the highest levels of what we do in society. This is my last slide. It's harder to crack prejudice than an atom. And I think that's what we're talking about here, is the cracking of prejudice, the movement away from believing that mental illness or emotional lack of emotional well-being is some sort of choice, that it's an option that you engage with. The most common reference is just pull yourself together. Can you imagine someone with, lung cancer been told to pull themselves together? Just wouldn't happen. It just wouldn't happen. Yet those are still common references in terms to mental health services. So I'm going to end my talk there. I don't know if I've got time for questions or not, but it's really just, I thought it was important this morning to say, I've got no questions about the efficacy of the physical activity piece. I think it's right, it's proper, and we need to do more of it. But I thought it was useful to explain to you why it's not as straightforward as just saying, well, if that's the case, why don't you go do it? Because I think the big backdrop here is much more about the prejudice that still exists around mental health services. So thanks very much for listening. I can take a few questions, I think.
Do you want to check? Okay, are there any questions for Joe? We have time for a couple of questions if anyone's got any.
I work in mental health services. I'm pretty much on the front line. And I'm an eclectic practitioner speaking this afternoon on trauma. So I'm really interested to know, very much in relation to the quotes you've given us today, what are the stats of your department in relation to mental health services that you deliver at the moment?
What are they?
The stats. Did you produce any stats on the services that you deliver in mental health services?
Well, how long have you got? I mean, I need to know stats on what?
Well, if you're used to mental health Merseyside, yeah. Well, if I was in charge of that department, I would really very much want to know what my department was delivering in relation to, good outcomes, bad outcomes.
Oh, right, okay.
This type of thing. So, given that you take forward the IAPT model,
We don't take forward the IAP model. We don't run IAP services.
You don't run an IAPT service.
No.
So do you know the stats of your department?
Yeah, well, I mean, if you want to, we make almost 600,000 contacts every year. We, for our inpatient services, routinely survey patient satisfaction and experience for every patient in a bed every week. Those come back largely very, very satisfied, but not always. We have, in the last year, run a pilot approach in the Trust called No Force First, where we have said, in effect, we're going to take physical or chemical medication-led restraint out of our services. And on our pilot wards, we've seen dramatic reductions in the frequency with which patients are restrained. As a result of that, we've seen an incredible reduction on some of those pilot wards in staff sickness. We have seen a small increase nonetheless in the number of our service users going into employment, but actually 97% of our service users are unemployed. Now I can try and influence that as much as I want, but I've got to get people who want to employ people who've got a mental health history. And people with a mental health history are 6 times more likely to be discriminated against than somebody with a physical health disability. We continue to deliver all of our services in budget. Every year for the past 5 years, we're 5% more busy, and we operate inside a block contract that gets reduced by 4% every year. So we're one of the most efficient organisations in the NHS. Where do you want me to? I mean, I can go on forever. Well, I'm talking about. Yeah, you can call them secondary care services if you want. You know, where I've got real problems, I've got problems in psychotherapy because I don't run IAP services. I don't run them. They're commissioned somewhere else, and I've got a 42-week wait for Tier 4 services, which is a scandal. You know.
Well, in those ways, we have a 2-year waiting list.
Yeah.
Yeah. So that is just much better. I was thinking somebody wrote and say, forget next year. You're just not going to get into for treatment. When we look at the IAPT model, it's got an 86% failure rate.
Correct.
You know, I'm interested to hear that you've got a 97% successful rate in secondary care. That you just said. You know, your outcomes are pretty good.
Well, satisfaction. Yeah, I completely agree. I completely agree. But nobody anywhere is measuring those.
Well, perhaps that's a point to start with.
Yeah, I think it is a point to start with. I mean, there's no question that that's a place to start. And it's not like we're not having those conversations. But, you know, like anything, when you begin to look at these sorts of approaches, it's very different from measuring what organisations normally measure. But, for example, in early intervention in psychosis, and on our memory services in and around dementia, we are part of a programme called Advancing Quality, where we look to see that key evidence-based interventions are being made, and we're one of the best performers in the country around those. Now, can I equate that exactly to a better outcome? Not right now, I can't. But you know, everything says, you know, if you do the right evidential things in the right way and in a timely way, which I think is what you're talking about, you're gonna improve outcomes.
You've got a better chance, but you know, primary care needs to speak to secondary care. But I have to one that's down the road. It's got a 42-week waiting list. You know, those patients are going to climb the ladder and enter into your service. You know, as a result of not being treated. You know, so I think better communication.
You speak in,
departments.
yeah, well, you speak in my language. I mean, I have these conversations every day. But, I mean, it's a great example of why, if you think that we can't get an integrated and comprehensive and sensible and timely approach to talking therapies, yeah, some of the stuff we're going to talk about today around sports activity is yet further down the food chain, yeah? So I mean, I think I'm agreeing with everything you said.
Unfortunately, we won't have any more time for any more questions. Just like to say thank you again to Joe.